Welcome to the MatriArch Podcast, a sisterhood of legendary Black queens in the making, speaking about real issues, questions, thoughts, ideas, lessons, and cultivating future experiences. So let's get our crowns, wine, slippers, and start the conversation. In this episode, we will be speaking with Dr. Patricia Kelly Marsh, a dedicated physician and co-founder of Ask Me Your MD, aka Amy MD, who cares for her patients and is passionate about the future of healthcare. Through her work with Ask Me Your MD, she aims to empower individuals with access and affordability. With years of medical practice, she is driving transformative changes in healthcare to enhance health outcomes both within her community and globally. By leading through service, she aims to improve healthcare outcomes for all. Dr. Marsh, while facing the adversity of her mother being killed by a drunk driver, carries her memory on through her work as a physician. Her mother was a nurse and her father was a computer engineer. She has combined the work and the dedication of her parents and paved the way for the future of healthcare and tech. She is an advocate for all patients and their families. She hasn't stopped with Amy MD. She is also the Chief Medical Officer at Randomize Now, a company dedicated to increasing culture diversity among clinical research sites to ensure that patients are able to participate in clinical trials and receive the best care. With her constant dedication to providing better healthcare to patients, MatriArch is excited to partner with Amy MD and our members, bringing them membership-exclusive pricing and bringing you this episode. So join us in this episode and join us as a member of MatriArch. Enjoy listening. We are so happy to have you here with us. We are just elated in so many ways. And we cannot wait to get to interview you here at MatriArch. And we are just super happy to have you.
Thank you for having me. This is going to be a wonderful conversation.
Yes, I would agree. So before we get to Ask Me Your MD, we're super excited to hear about, at MatriArch, we try to get from a personal realm, just understanding you, how God made you essentially, and how you are going through this journey. So tell us a little bit about yourself and how you got to Ask Me Your MD.
Yeah, at the core of who I am is a person that cares for people, a heart for just my fellow human beings, my family, those who have shown love and support to me, and truly make like this global footprint and mark and leave a legacy. So that's like the core of who I am and why I do what I do. And all of that began in College Park, Georgia, where I was born. My mom and my dad was a computer engineer. My mom was a nurse, but I didn't know she was a nurse until I was 12 years old, the day that I said, I want to become a doctor. Oh, and wow. I will never forget that. Like my dad never spoke about my mom. She died from a drunk driver who killed her when I was just a baby. I was 9 months old. And so I grew up not really knowing who she was until that moment. And then once I, made the connection of, oh, well, like she had this whole background, I began to ask my grandmother, her mom, all of the questions, like who was she? What did she do? And my grandma would always share all of these things about my mom. And so it was weird because like out of the four of us, the one that definitely couldn't have had any memories, but I was the most like her of the four of us. And so it was just a weird way of like, how they say, is it environment or is it genetic? It was a weird mixture of the two. And so with that foundation of my mom being a nurse and my dad being a computer engineer, it's like, of course she would be a co-founder of a health tech company.
Yes, I love it. I love it. And so that's very interesting because I find that the most inquisitive of the group of siblings is always kind of like that, has that forethought to say, hey, this is why is it this way? And then how can we change it? How can we make it better with this analysis and systematic approach? So I ring true with you to my heart in that. My father was a tool and die maker. My mom was a chemist, but I mean, that just rings to my heart so, so well. And so I love the fact that your grandmother, though, we talk about matriarchs and the importance of, people, the village basically pouring into your cup, and how your grandmother talked about your mom and her being a nurse and you not finding that out until you were older. I'm like, oh my goodness. So that is really, really cool. And I love the fact that you took on her personality traits and it kind of, well, it seems as if, she is within you and that gives you a stronghold to her. Correct me if I'm wrong, but those are just the vibes that I get. So,
Absolutely, absolutely. I will always say and believe that my mom must have known something because she named me after my grandmother.
oh,
And me and my grandmother were like, we became best friends. Like I got to know her as like a woman, and I'm just like, man, she was pretty badass.
I
Like,
love it.
okay, this is where I get the spice from.
Yes, I love that. And you do walk in your spice and you do it with class. And I love that. Those of you that don't know Patricia or Dr. Uh, Patricia Kelly Marsh, it is a great opportunity to get to know her personally and in what she does because your heart is wherever you go. And I think that that definitely shows up into Ask Me Your MD, which I got a privilege to look at. So, as we go into, so tell us about how you started Ask Me Your MD.
So, Ask Me Your MD was the brainchild of my co-founder, Dr. Sirit Nishan. So, she was my best friend during residency. She was in internal medicine. I was training in family medicine. And we had ICU rounds together. And where we both used to get in trouble was the time it would take us in explaining things to the families of the patients, because we would love for them to know exactly what's going on. And of course our attendings or bosses were like, hurry this up.
Yes.
But that's how we connected, and we truly bonded over wanting to educate and answer those questions for the families. And so we just bonded even outside of training. And she really saw where I had two other concepts, because I've always wanted to invent and make technology. And so as soon as I finished residency, there was like all of this time, because you're no longer working like 80 to 100-hour work weeks. You have time on your hands. And so I built the two platforms that I had told her about that were in my head. And then she wanted to make the world's best doctor chat. That was the concept. That was the at its simplest form. And at the same time, in 18, I had just gone through being on the other side of medicine, caring for my dad who was hospitalized. And he had like an emergency that let me see, if I hadn't been there or known that knowledge, he could have passed. And so I was like, you know what? I want to join you in these efforts. I want to make this platform because I realize the value of the knowledge that we have, like in the moment that people are
Yes.
experiencing these issues. And so I just put her idea, like my mind, in the technology space. And I was like, this is what we should do. We should start a new sector of telemedicine called telechat medicine and make it safe and tell the world like this is can be done in this way. Yeah.
Absolutely. I second that. As you know, and some of our audience may not know, I had a daughter diagnosed with cancer, neuroblastoma, 3.5 months old.
Mm.
And those seconds count so much. We had been to the hospital during her treatment over 152 times. And those moments do count, whether it's, hey, we're rushed here because she's throwing up too much or what have you. Well, what is too much? What is her limit? And not everybody has the access and the charts that they can get to as fast. And that information exchange between your doctor and your care are so, so important and so
Yeah.
crucial to the success of your health, if I'm just keep being honest.
Yeah.
So love the fact that Ask Me Your MD combines the technology and the time. I mean, I'm glad that a lot of people have healthcare, but we have to call out our experience in going to the doctor. It takes you months and months, for me, about 2.5 to 3 months on average to get the
Yeah.
kids in and get them seen. So when I am leaving, I make sure to go ahead and make the next appointment. I don't
Yeah.
know if they'll be sick. I don't know if they'll be, but at least I have that on the books if I'm
Yes.
worried about something and I can follow up. So with that, now that's just from a parent perspective, but also from a Black woman perspective. Tell us about Ask Me Your MD and getting over some of those hurdles that we face, not being heard in the doctor's office, and also just the time. Time is so valuable.
Yeah, and it truly is. Understanding that on average in America, you're waiting 26 days or more to get a visit, and it's going to get worse, unfortunately, because we don't have enough doctors being trained. And so the wait times are going to be stretched. And in addition to that, we wanted to tackle the problem of affordability. And so we know that prices have been going up. We're paying more for health insurance, but your care is actually either the same or worse. And so, we really have to change how we approach availability within the country. We know that we as doctors avail ourselves to our own families or those who are privileged to like have our number and like be able to have that one-on-one, kind of consultations whenever they please. And so why not make a platform that speaks to that actually answers the question, can I, as a poor person, like reach out to a doctor when I feel that I need it? And it's like, yeah, you should have that privilege. And so we wanted to definitely make our services available to not your average person that would have that.
Mhm.
We want to kind of democratize. I hate to even say it like that, but we want that affordable and accessible care, not based on your socioeconomic status or your social determinants of health. And we look at these other models of healthcare within other countries and see that on average, like in Japan, they go to the doctor 26 times a year. Because
Wow.
you just have that access. It's just that easy. And so anything that we create, there's going to be pluses and minuses, but this definitely takes the cake as far as like filling in the gap in that wait, in that worry time, in that concerned period, in that time where you really need some peace of mind. Yeah.
Yes. And the peace of mind that you guys will be able to give, I think will shorten lines in the grand scheme of things, right? So when you talk about that worldly view, when you talk about, hey, the time that we want to give this level of service to help people, it actually helps alleviate a strain on the healthcare system in general. So I
Yes.
think that's a huge, huge advantage that Ask Me Your MD is actually doing. And long term, I think will have that effect, is what I'm trying to
Yeah.
get at. But so I think that that is great. So tell us what sets Ask Me Your MD apart from the other telehealth. We find, I had mentioned earlier how people of color in particular don't necessarily always feel heard by their doctor and things of that nature. How is Ask Me Your MD, helping with that?
Like what you're hearing from the MatriArch Podcast? Guess what? There's more.
So make sure you check it out on matriarchmom.com. We have a place for you to join our sisterhood and to be a part of something great.
Yeah, so you get to be heard when you want to be, and having that autonomy and having that control really does something for like even me on as a patient. Just on the other side, I'm like that experience in and of itself is empowering. You're taking your own care by your hands, and not subjugating it to like the schedules of clinics that be or like so that part right there, I think when you get to be heard and availing ourselves to hear as physicians is definitely something that sets us apart. What also really differentiates us and what we have actually been told over and over again is no one else has like this one-stop shop, 28 specialties that have been collected under an umbrella where you can have this real-time consultation. It just doesn't exist. The solutions that are out there now are usually geared towards urgent care, primary care, but how many of us know that it takes 3 times the copay to see a specialist? Why?
I know.
Why we set it up that way? I get it. I get it. I get it. I get the way that the system works, but I still have to question, why is this still a thing?
Yes.
So we've created a solution that really tears down that barrier. Time, because their weights are triple that and their costs are triple that. So we wanted to help communities who are underserved, communities of color who don't normally have access to these subspecialists in the first place and can't afford to see them, to be able to do that at one place, one go at it. And so that's a true distinguishing factor. You don't have to get a referral to talk to a cardiologist anymore. Amy
Exactly.
MD lets you do that for $35.
I'm snapping. Let me make sure that's on camera because so I've worked in healthcare. I've done healthcare marketing and I've done pharmaceutical marketing. And I know on both ends what that looks like. And the fact that you have to go through 3 to 5 doctors before you're seen by a specialist to rule out and then make sure the insurance is covering this, and this is absolutely atrocious. And I know it's there for a reason. I know the reasons that they're there. However, the time constraints, the doctor availability, all of the above are just, it's highly unrealistic and highly unsustainable. And I've
Yeah.
thought that from day one. I knew that we would have to unfortunately face a lot of things, tweak as we go, build the airplane while we're flying it, per se. This is the time, and millennials, as crafty and creative and innovative as we are, and the tools that we have now that are available that you guys are using with Ask Me Your MD are just so crucial to catapulting us out of the healthcare that we have now into the healthcare of the future. So we definitely appreciate you doing that. I mean, you guys have the foresight, the tools, and the resources to do so. So we are so thankful. I know this is just the beginning, but I cannot tell you
This
how
is exciting. This is
about
really
what.
exciting.
So, without getting too into the weeds, I have to ask some B2B questions due to my background, and some of them are with your current customers. And this isn't business to consumer. This is more so business to business. What's the one thing that sold them on Ask Me Your MD?
The price and convenience. So it always gets back to our double A's, accessibility, affordability. And at the core of our mission, that sits. And that's what we've built everything around, accessibility and affordability. So as long as those two objectives are in our scope, they will be attractive to a lot of people because, again, it's rare that you find all of those subspecialists in that one place under that same affordability and accessibility model.
Love it. And that it's interesting because I think that's the B2B and B2C, to be honest.
Yeah.
it's just blatantly obvious that is the gap. And so the fact that you guys have covered that, I think, is absolutely amazing. So with the pipeline customers that you guys have, what's the number one piece of feedback that you're getting?
We're getting the feedback of like, I can't tell you how many times people actually believe it. They're like, is this a real doctor? I had to deploy the camera on the telechat because this guy was not having it. He's like, is this a robot? We've had that feedback. Is this a chat bot talking to me? Am I talking to a real person, a real doctor? Because it's just so kind of out of left field. The other thing that we get feedback on is like, do you know my health? Can you access my records? Can you, help me in the context kind of where I am now is what it boiled down to for us. And so we took that feedback and made sure that we're connecting to other electronic medical records so that we can get the information that we need from the patient to learn more about them, even though they're seeing us, for usually very quick consultations. But still, it's very important that we see them as the whole person that they are in their health journey. And so those were like the top feedbacks that I can like definitely anticipate coming across again and again.
Yes. And let's just be honest, like the patient market, consumers just in general across the board are like, okay, what is real with AI? And, we just have to call it out, right? With AI impersonating people, we've got bots that are before us pretending to be.
Right.
And there is this distinction that we have to make. Is this authentic? Is this real? And I think that authenticity that you guys offer and that you also just show the transparency that is needed as you go along. Like, hey, if that guy needed a camera, then that's just
here
what
we
it
go.
was.
Like, I'm here. Hi.
But, I think, as we go along and we live longer with AI and the smarter it gets, and the more intense graphic and user interface we have that is trying to sort of pose disbelief to the eye, if you will, we're going to need that transparency. And oddly enough, and I don't know, well, knock on wood, I do feel that people will want to be more person to person versus virtual. I don't know. I'm just putting that out there until we address these changes. But the tech is just so new and we're using it essentially for the first time, right? We know AI has been around for a long time.
Very long
However,
time.
consumers and patients and the usage that we apply is going to be, while it's new, we're going to be cautious, right? And
Right.
so with that transparency that you guys offer, it's going to be all the better. So I just love the fact that you guys not only had that feedback, but you were able to address it as well.
Yes.
And give your patients that protection and trust.
Yeah, absolutely. And that's the biggest thing. When we were writing the business plan, Sarah, Dr. Mission, my co-founder, she definitely saw that as being one of the ways in which we could develop that trust and grow that trust, the availability portion of it and the direct communication between patients and physicians, and not having you have to talk to this person, and then come to us. And so really did like that model and like the fact that, we could rebuild the trust that's been lost in this age of misinformation, disinformation, and lack of access. So it's like, I can't trust you if I'm not talking to you, if I'm not even able to contact you. So now that I have this opportunity, let's see how this goes.
Exactly. And I do, also want to mention, just to kind of segue us a little bit. Like what you're hearing from the MatriArch Podcast? Guess what? There's more. So make sure you check it out on matriarchmom.com. We have a place for you to join our sisterhood and to be a part of something great. as patients are given, whether it's a diagnosis of something light, as far as, let's say, eczema, to cancer, right? How does Ask Me Your MD sort of help with that? Those are two different conversations, right? And I know that you were saying, when you guys were in the ICU and, building those relationships face to face at the hospital, that's going to be different online. So tell us a little bit about that.
Yeah. We have had, patients that have had diagnoses of cancer that don't know where to start, that don't know what it means, that utilize us as guide, anti-anxiety, a reassurer, second opinion, and having that availability to render those services to patients in their time of need has been one of the greatest accomplishments of this platform. And so we are able to have those conversations through text and like add emojis. Like, dude, this is like something you'd never really think about having with your physician. And it's so personable. We've had the line of like, it's almost like having a doctor in your family because you're able to text in and just have that conversation. I want people to think about their relationship in person with anyone in their family or their friends, and then think about that relationship via direct messaging, text messaging. It's completely different. It's so personable. It's like this closed in door that is very personable one-on-one. And so when you bring that into a journey that may be difficult within the healthcare space, there are few solutions that provide that. And so Amy MD takes ownership of that and tries to make the foundation. And we call ourselves the mothers of telechat medicine because we want to hone it in and let it be a safe haven for those of us who do get diagnoses or are caretakers, because this is where we've seen it a lot on that side of those who have very difficult diagnoses.
Yeah, I think, and this is just through my experience, and I appreciate you telling us like the due diligence that you guys have and the personality, like tangibility, I guess I'll say, where it's like, hey, we are here because team, when you have someone, whether it be yourself or a family member that has cancer, literally takes over your life, and you need you need your team of doctors, you need your cheerleaders, all the things. And I just have to give kudos to women doctors, just a shout out. We love you too, men. We love you.
We do, but
I
it's
will
different.
say, women give a care factor as doctors that is really tangible. And by that, I mean, you can feel it. It's heartfelt. They take the extra time. And I'm not saying we definitely have male doctors that do that as well. So I don't want to, go male to female, but just the interactions largely, the females really get that this is a holistic care for the patient and they're healing whatever it is, whatever their specialty, whether it's heart or, what have you. Um, they're filling in that specialty, but they're also making sure that, hey, you're okay. And we're not just like having you fill out the paperwork. Like, I have
Yes.
touched you on your hand. I have given you the physical. I am asking you if you're okay. I am asking, those things matter so much when you have a patient with cancer, and
Yeah.
or just health overall. But walking through that, we found that in our team that the women really just extended an extra branch in their care, and we were so so appreciative of that. So kudos to the female doctors. We love you too, men.
Shout out to the
I just had
female
to get that
docs.
spelled out. Not that we can't all work on our soft skills, but that is so, so important to the patient experience. And I definitely, when I worked in pharmaceutical marketing, definitely relayed that and made sure that, hey, doctors, when you're speaking to your patients, this is what matters. But yeah, so thank you guys for being that for the patient because it really, really matters. So, with that, I know we're about to wrap up, but what do you want to leave us with, Amy MD? What do you want to leave in our minds? Where can we find you? All of the things.
Yeah, so I just want it to be known that we are here. We're here for you. Ask Me Your MD, Amy MD. We're here for you. And you can find us on askmeyourmd.com. It's one click and that's it. You're connected to us. We're not trying to make the barrier of accessing a physician harder than it needs to be, especially in this time, in this age. And we know where the industry is going and where the country is going over the next just 9 years. And so we have to be one of those solutions and reliable and trustworthy solutions that we want you to try us out, see what it is that we're offering and see how it fit in your health journey or those of the ones that you're taking care of. And we always want to just have you empowered in your walk, in your health journey. And so wherever we fit in there, let us fit it in for you. If it's the convenience, if it's the accessibility, if it's the affordability, whatever it may be, let us be that for you. And then tell your friends, definitely tell your friends about that experience because it's going to be required soon, much sooner than later.
Awesome. Well, thank you. Thank you for
Thank
just
you for
allowing
having
us to. Yes, absolutely. The feeling is definitely mutual of having you here, not only with your brain power, but with everything that you are trying to do and the footprint that you are trying to leave upon us. We thank you so much. We are ever grateful. And we are just, yes, ever bountiful. So we will definitely be talking to you again to follow up.
Yes.
Are and going from there. So thank you guys so much. Thank you to our listeners. And we'll talk to you later.
All right.
MatriArch would like to thank you for listening to our podcast. Please visit matriarchmom.com to continue the conversation and join the sisterhood of other legendary Black queens in the making.